Hello, my name is Carolina, and I'm representing the Down Syndrome Association locally here in Brazil. The title of our work is Multiprofessional Care for People with Trisomy 21 and their families during the Covid-19 pandemic, a Brazilian report. This is all our team working in the Holistic Family Center, and Lisley Sofia is the actual president of our association. As an introduction, I would like to present our association. Here is Brazil, this is the Espírito Santo state, and Victoria is located on the coast and is the capital of the state. The name Asociação de Pais, Amigos e Pessoas com Síndrome de Down do Espírito Santo, Victoria Down, is our association, and it has 23 years of experience in working with Down syndrome people and their families, promoting continuous improvement and citizenship rights for this group of people. We also are affiliated, this is the logo of our association, and we are affiliated to the local stage association for parents and friends of people with intellectual disabilities, APAI, and also for the National Association for People with Intellectual Disabilities, APAI Brazil, and also for the Federation, a Brazilian Federation for all the associations of people with Down syndrome, and the National Association who support work for people with disabilities. Internally, our association, Victoria Down, is divided in 4 centers and conducted by a voluntary directory. We had a financial administrative center, an institutional development center, a skills development center who works with inclusion and work directly with the people with Down syndrome. And we have an holistic family care center who work with the whole family. We consider that there is no such an improvement when we only work with a person with Down syndrome, rather than we work with the whole family, because the family is the first group of social interaction that all of us has, and is a group of people who is going to keep with this person with Down syndrome along the whole life. So they have all the history life from conception to the adult life and to the elderly phase of this person. So we find essential to work with the whole family of each of our people with Down syndrome. The objective of this work is to report our experience from face-to-face multidisciplinary care and all the implementation we need to do from remote care to reduce the negative impacts of the overall health and inclusion for people with Trisomy 21 and their families during all this pandemic period. In this photograph, we show our meetings before the pandemic start. This is one of our playgroups in the auditory of our association. And as you can see, it was a very rich moment in where the families could interact with the professionals, they get to know, they get to build a network of support, and it was such a pleasure to be with all these kids and see them growing in a health environment. Before start our the pandemic time, we already have a methodology focused in reduce all these social economic factors we already have here in Brazil. So we have several families who already have unemployment, and of course the pandemic grow and make the risk greater. We have families with low access to services, and during the pandemic was an absence of some services like health service, educational services, or social benefits. The pandemic put more risk to all these services. We have families who live from their extended families and have an absence of a network support. Excuse me. We have large families with several kids. We have families who are single parents, and also this is a factor of a risk. And we have families with low level of education that really need all our support to find all the strategies and to grow and their kids and offer the best opportunities. So during the surprise of the pandemic in March 21, we reorganized all our activities in order to provide all these services and care, and we didn't stop our work. But the adaptation and reorganizations was in order to increase the professional team, put more activities, and also adapt the methodologies, because we didn't have any online services or groups before the pandemic. So we start with video calls with several platforms. We increased the phone calls to keep contact with the families who didn't have internet access. And we also did some home visits to check how they were doing. So talking about this reorganization in our multidisciplinary team, I would like to let you know, before the pandemic, we already have a coordinator of this center, who is an holistic family consultant. That it's me. I'm in this position now. We already have a speech language pathologist who was giving some orientations to the work team and also to the people with Down syndrome and their families. We had a social worker. We had already a psychologist and an occupational therapist. But during all this time, we feel the need to increase the social worker team to offer support for the families. So we call a social worker trainee. And also because the isolation of this population were bringing some disorders in the nutrition, we call a nutritionist who is offering healthy recipes and controlling the increment of weight of several of our people with Down syndrome, especially teens and adults. And also to check the health of them, we call a nurse who is doing a screening and a following up of all the people who is associated and come here to our association. I would like to mention that all the activities and the slow return to face-to-face activities during 2021 were guided by the health department and also for the World Health Organization. All these face-to-face activities, when we return, were only when the risk map and the epidemiologic report made it possible for our team to meet this public. Here we have a teen and an adult girl with Down syndrome who received the vaccination. We were so happy when these people could have this opportunity to prevent the disease. We also had all the professionals who are working in the association vaccinated, and as well as I mentioned, the people with Down syndrome, first of all, over 18 years old, and then they start to vaccine here the teens over 12 years old. To the present date, in the state of Espiritu Santo, 80% of the population received the first doses of the vaccine, and 53% of the population is completely vaccinated. So all the parents and relatives are also vaccinated, so it made it possible to return to some of the face-to-face activities. And I would like to mention which were these activities we were offering here. We have the welcome to new parents. So when the couple receive the diagnosis, could be during pregnancy or at the moment of birth, we go with a multi-professional team and orientate and welcome this baby and this family in our association. We continue to do that, but only online, but video calls, and when it's possible, presently they start to come again face-to-face to the association. We already have orientation meetings with some professional who was talking about a specific theme, which could be law or could be education or some health-related specific area, and we keep doing that, but in lives or in online platforms. We have a monthly siblings meeting, and that was here in the association, and now is by Zoom. We have a woman self-care support because we noticed that the moms are the most, that assume the most responsibilities and care for the people, for the person who has Down syndrome. And we keep continuing with that support, but on online platforms. We have the playgroups, as you will see in the picture, and we could not do these playgroups yet. We have family meetings that also we stopped during the pandemic. And we use also to visit the maternities and the hospitals when the baby was born, and also to talk with the professionals about the best way to transmit the diagnosis to the family, and to do it in a very humanitarian way, and let them know that we have an association, a local association here that could receive and care for them and welcome them in this network of support. So during the pandemic, because we could not do all this stuff in the association, we start to do some home visits. We have donations and distribution of food, personal equipment, protection equipment, diapers, hygienic supplies that the families were picking up here in the association. When it was not possible, we distribute this in the houses. Nowadays, we support already 40 families each month with all these supplies. We have interdisciplinary health consultants, so the nutritionals and the speech pathology and the nurse and the psychologists were working together in consultants online or here in the association when it was possible. We increment the social screening of each family to know exactly what were their needs and contact that with the benefits and support, the social support they were looking for. We also offer entrepreneur skills workshop to try to help the families to overcome this financial vulnerability situation. We offer workshops to make cupcakes and also to crochet with some arts, to do products that the families could sell, have an extra income. The psychologist of our association did a family need scale in order to map if the most risk factors were emotional, behavioral, economical, or which kind of need they were working in order to support in the best way possible. And as part of this reorganization and new methodology, we increase our partnerships. So the Victoria Down did partnerships with universities that offer some support in law, in rights for people with disabilities. The architecture faculty is trying to help us to support the home conditions of some families. And also some universities are offering therapies for people who could not have these services. We did a partnership with a genetic lab which is offering the karyotype for families that could not afford it privately and could not obtain it by the social health services. We did a partnership with a bus service in order to offer a free pass for the person with Down syndrome and one adult who traveled with him. We offer some educational support because most of the kids were out of kindergarten or school, and the families need to make the stimulation and cooperate with the schools in an online services, and they didn't know how to do that, so we offer that support. We did partnerships with other associations and with the Brazilian Federation of all Down syndrome associations. And we call here the Reference Social Service Center to register all the families and get to know how many we are and what are the services we need. So as a result of this work, we could say that we increased our professional teams. We didn't stop the activities and services. They only went from the face-to-face to online, and slowly we are returning to the face-to-face consultants. We decreased the isolation risk factors. We had an adaptation of our activities and service during the pandemic with the engagement of the families. We have families from the other parts of the state and another states. We could distribute these basic supplies to attend the family needs. We had multidisciplinary orientations for individuals or small groups. We increase our partnerships, the public partnerships and the private companies to support our work. We have an extensional social work discussing public politics that support our families and also offering the family assistance. We increase also the emotional support for individuals with Down syndrome and their families also in small groups. I would like to show here some of the families where we're distributing diapers and supplies. This is our social worker with a car full of supplies ready to go. And this is another family who received all these supplies. And as a conclusion, I would like to say that all these hybrid activities help us to extend our geographic reach. We decrease the isolation and risk factor that were the lack of assistance. We support the social hunger. We increase the number of families who obtain social benefits due to the social worker's job. We reduce the risk and vulnerability factors faced during the socioeconomical impact, contributing to the health development of this population. This is the nutritionist with one of our kids and talking to the mother about healthy meals and introducing healthy meals. This is our psychologist, the social worker with another little boy with Down syndrome, and this is our occupational therapist working and stimulating a young baby. As further plans, we think about increase the physical space. with medical clinic and a multisensory room. We would like to implement a medical assistance here in our association. We would like to plan more outdoor family meetings like we did in the past, that shows in that picture, in order to strengthen the interpersonal connections and support network. We also are going to start with individual clinical therapy to supply the healthy psychomotor development. This is the front door of our association, and this are all the social media and where you can find Victoria Down, Facebook, YouTube, Instagram, Twitter, and this is our site. And this is the work we have today. We are open to comments and interactions with our association, so please contact us, and thank you very much for this opportunity.